Good afternoon, everybody, and welcome to Zon Academy. Today, we have a special lecture on lab 3D printing, processing, and safety 101. And our speaker today is Paolo Lubrano. Paolo is an MDT, and we're so excited to have him join us today. Thank you so much, Paolo, for spending the time and researching and coming up with the best lab safety practices in 3D printing that I've ever seen before. So we just so appreciate you joining us here at Zon and being able to give your insight on keeping our customers safe out there while they're making these beautiful restorations for their dental customers. I just want to let everybody know that Paolo has presented us with, some poll questions that I'll be launching out there during his presentation. So if you wouldn't mind, please be interactive with us. We want to hear what you have to say out there, and I'll be launching them, like I said, during his presentation. We will also have a live Q&A, so don't be shy. If you have any questions for Paolo, please type them in at the bottom of your screen at the Q&A section. I'm going to turn this over to you, Paolo. Thanks again for joining us.
All right. Hey guys, thank you for having me first, and thank you for joining my webinar. Hopefully we're all gonna learn something new today. And I did a lot of research, honestly, in the past couple months on this topic, and I'm sure I can probably do a lot more research and dig a lot more stuff that I don't want to know, probably, because it's pretty scary what I was reading in the past couple months. And so yeah, let's start. All right. See, let me know if you can see my screen.
We are good.
Perfect. All right. 3D printing processing safety 101. Hopefully I can do a 102 as well at some point. All right. So first I'm going to introduce myself a little better. And my name is Paolo. I have a variety of dental background and on my career. I started as a clinician and turned into a lab technician, and I get my master's degree in dental technology. And I grew up as a ceramist up until 5-6 years ago, more or less. And I decided to start. I had to basically start doing digital world where 3Shape, Axocad, and whatnot. And because that's where their industry is going right now. I currently work for Implant Concierge. For those who don't know, Implant Concierge is we're specialized in guided surgery, and we do from your single tooth boring guide to up to a stackable surgical guide. All right. So as I said, I grew up in Perugia. I studied dental school at Università di Studi di Perugia, turned into a technician for right after dental school, really. And that's where I decided that porcelain was my thing. I didn't like dentures. I still don't like dentures. It's not my thing. I never liked it. To me, it grosses me out at some point. But this is where my hometown is. That's Fontana Maggiore. It's we always went there and study outside and whatnot. My free time, I do a lot of triathlons. I normally do 3 to 4 triathlons a year, whether it's a half Ironman or a full Ironman, and I just enjoy doing it. It released my stressed environment basically, and let everything out. And when I come home, I have 3 dogs. I do work from home. I currently have these 3 dogs that are laying around, and if you do hear barking throughout the webinar, I do apologize. I cannot control my dogs if they see another dog walking by and they start barking out loud. Just a little brief on Implant Concierge. Implant Concierge, as I said, we were a true implant coordinator. We're specialized in guided surgery solutions, and we partner with labs, and we partner with also office as well, and we combine the two pieces together basically. So we're a service to help out whoever is not proficient in guided surgery, or they're not sure if this can be done. They're not sure about how to read cone beams. We help out basically. All right, today's topic: processing 3D prints and staying safety while printing. So There's going to be bits and pieces that are going to go off topic, because I feel like it's part of the our nature. When I say our nature, I mean mostly like laboratory field and also um, dental office field, because there's a lot of offices out there that are 3D printing. There's a lot of offices out there that are milling their own zirconia, milling their Emacs. Granted, Emacs is a little quote unquote safer than zirconia, in my opinion, but you still have to follow their safety protocol regardless of that. So there's going to be some bits and pieces that are going to go off topic. So keep in mind on that, be aware of that. But I hope it's going to be good. Um, I'm going to start off with 3D printing to start. And I'm going to go over some printing emissions and how to um, and what to look for when you're 3D printing. And there's going to be a couple of slides also on how to process 3D prints, whether it's a nano ceramic hybrid print resin, or if it's a surgical guide resin, all that kind of stuff. All right, health and hazards of 3D printed emissions. I don't know about you guys, but that's been always my biggest concern when I started getting into 3D prints. And I remember my first 3D print experience was 12 years ago when 13 years ago when I moved to United States. And I remember they bought this massive printer that can only print 12 units at a time for the overnight. And I remember that wax, that powder resin that we had at a time smelled horribly. And my first instinct was, I'm gonna stay away from the room. And I never understood the reason. And it was it was something that I didn't like. Like, when you go to a denture department in your lab and you smell melted wax, monomer, that stuff is not that great for you, right? We all know that because it's been around for years. 3D prints are not really, this resin is, I wouldn't say it's been out recent, but it's fairly new, definitely newer than monomer. Monomer's been out for decades. I don't even know when it came out, to be honest, but it's been out for decades. And yes, I'm one of those weirdos that love the smell of monomer. I gotta be honest with you, and it's definitely not good for me. I know that, but I still smell it once in a while. I shouldn't probably say that, but too late now. All right. So the process of 3D print releases emission that can pose significant health risk. So the VOC and the ultrafine particles of the UFP, you really can't see them. So every time you're printing, even if you don't smell, it's still there, just like IPA, isopropyl alcohol. And there's other solution compared to that are different from isopropyl alcohol that I'm gonna go over a little bit in the next couple of slides. So you always have to keep in mind, you always have to wear PPE, gloves, mask. Honestly, I wouldn't use a mask like a regular surgical mask. I would probably use a respirator mask, one of those. I think I have a picture later that I can show you. And I would use one of those, sophisticated masks for fumes, basically, because it just it helps you. You don't want to breathe in any of those chemicals in your lungs and gonna get stuck there, and you can't get it out. It can, in a severe cases, it can be permanent. It can be permanent. It can have lung damage, like on the third option, right here. It can be permanent, but you can also have respiratory system leading to symptoms such as coughing, throat irritation, and more. It's not, I can't say that it will happen if you don't take precaution for that, but it may happen. So just like when people are asking, I touched this resin, I saw that a couple of weeks ago on Facebook and on one of the dental 3D printing group that I'm in, and I saw I have this rash on my on my hand after touching the resin. I was like, well, why would you touch uncured resin without gloves. You shouldn't do it. So we have ways nowadays that we can prevent that stuff. And it's not just PPE, it's not just glove, mask, shield, or eye protection, that kind of stuff. There's other stuff that I'm going to go over with. So as I said, the VOC, one of the things that are really dangerous about the VOC is that they vaporize at room temperature. You don't even know, you don't see it. And one of the things that I researched during the research, and I was actually hoping to find a nice chest X-ray, but I couldn't find anything decent. One of the things that I've noticed that the VOC are also known and suspected for cancers. So I know I don't want cancer. That is for sure, and I'm sure no one wants it. I'm I'm a health nut, so if I can be as protective for my lungs or any other my body parts, I will make sure to do it. So another thing that you need to consider is IPA. It is considered a VOC because yes, you can smell it, obviously, because IPA is really strong, but you can't. Um, if you ever leave the container of the IPA open, it vaporize. That part you don't smell it. That part you don't see it. You smell the initial part, you smell the IPA itself, but once it start evaporizing it in the room temperature or in your room in the area without any ventilation, without anything, you don't see it, you don't smell it. You just don't know that it's there. You realize, oh my God, my IPA level it went lower. I forgot to put it on, to put the cap on. So it does evaporize. As mentioned before, always use PPE. Don't touch uncured resin with your bare hands. It Just don't do it. It's really bad. It can cause skin irritation. It can cause rash. It can be permanent rash. As I mentioned over there, it can be from mild state to severe, and you have chances to get allergic reactions or itchiness as well. And I've seen that happen actually. I had one of my former employee that had in my previous job where he touched it right after coming out of the build plate, and he touched it, and 2 hours later he couldn't stop scratching himself, and he ended up going to the hospital ER and get some medication for it. So one of the reasons why I put some resins smell very bad and it can cause dizziness is because that actually happened to me. I didn't know. I remember getting this when I first got my Einstein printer a few years ago. I bought a bottle of Flexera. I opened it. I loved the product. And the color was beautiful at the time. But man, as soon as I opened it, it smelled horribly, and I thought it was a bad batch. And I bought a new bottle, same thing. And then I started doing some research online. I asked people. It's like, oh yeah, the smell is terrible. And I'm telling you, as soon as I opened it, I took the first sniff by accident. It gave me a headache. I had to walk out of the room, and I was like, I can't do this. I need to go outside, get some fresh air, and then 10 minutes later, I came back inside and do my thing. The room that I used to work didn't have any ventilation. It was pretty bad, honestly. I always had my mask on. Um, and eventually we did upgrade and we got some ventilation. It got much better. I have a scary little video that I would like to share, and it's this one. You can clearly see all the fumes that is emanating, going out from this plant, obviously, but you really can't see all that junk that is coming out of any of your printer. Basically, you can't see it. So I'm hoping that this image gets stuck in your head, like it got stuck in mine, and then that's the only thing that I can visualize right now. Because you can see everything, but you can't see anything when you're at the lab or at your dental office. The resin, IPA, any other products that you can possibly be using, you don't see this stuff. So I noticed that one of the reasons why most likely some of the and that was our reason too, it was about cost. There are, they're pretty pricey at the end of the world. At the end of the day, they're pricey. All these purifiers, suction units, we're looking at thousands of dollars, really. But keep in mind, reason why I put this line is because yes, it might cost you $4,000 now, but at least you're not paying ER visits, oncology visits, any other doctor's appointment visits. That's a lot more than this. I don't know how much a chemo treatment is, honestly. I have no idea, but I'm sure it's not $4,000. I'm sure it's a lot more than that. So always keep it in mind that it's an initial investment, but it's for the good thing. It's a good thing that you're doing for yourself, for your family, for anyone.
Yeah, because their families to them, to all of you out there, our families look at us as priceless, right? Our
Yeah,
health is priceless, and to your children, to your mom, to your dad, to your brothers, whatever, friends, loved ones, like, we're priceless,
yeah,
so that's how you should look at yourself. Absolutely.
yeah. And again, it's coming from someone that is 100% a health nut. Like I probably have a mental issue about being healthy, but you got to keep in mind that everyone cares about you, and the last thing you want is like, hey, um I got sick from work because of work. Like I've met ton of people 10, 12 years ago where, oh yeah, I got sick because I've been grinding metal, copings or partial dentures, chrome dentures without a mask or without gloves, without anything, ended up getting cancer or similar situations. So it's that you got to be proactive with that. So one of the reason why I decided to put this picture, uh, this was printed and wrote in Titan, and I want to show you something interesting about these two prostheses. So you can see this, right? You can see this and this, and I'm sure this one too. So those four things, and actually this one too. Now that I'm looking at better, these five things, they're not part of the prosthesis. Those are resin that is dripping out of that prosthesis. So why did I put it there? Is because you don't know. Yes, it's cured resin, obviously, because everything is already, it's not uncured anymore. It's pretty much cured. It just needs to be final process, basically. But that's your first processing. So those five parts, if you're not careful, like you're just wearing gloves, you snip it out of that bill plate, and one of those, you don't realize that those strip goes on your forearm by accident, that it can cause irritation, just like I said before, or a rash or something, anything. And it can be mild if you don't know you're allergic and you ended up going, oh my God, I need a shot of cortisone or whatever they use for allergies. Um, you got to keep it in mind with that stuff. I normally, when I process these and I see a lot of dripping coming down, especially with, all these nano ceramic, they're really dense. They're much more dense than your regular model resin or surgical guide resin. Although surgical guide resin can be a little more dense, but is definitely not as dense as your nano ceramic, like Rodin Titan, ONX Tough, Sculpture 2.0. I'm sure there's more that I can think of right now, but you got to keep it in mind about that. And what I do is I let it drip. I try to make it on. I put it on sideway. I printed out of the model material. I printed something that I can hook that bill plate of my Asiga and let it keep dripping until nothing's there. I'm not in no rush when I print these, so I just print, let it drip everything, and move forward with the case. So that's what I like to do with most of my print, and that goes with surgical guide as well. Model resins. Model resin is a little easier in my opinion because it's a little more liquidy, so it tends to drip a lot faster and less residue on the build plate as well. Fume hoods. These can be really expensive. I have no idea about the price. I know for a fact that the Quatro Air does make phenomenal products, and I'm gonna put it out there. I'm not selling anything for them. I'm not their KOL. I'm not I'm not a salesperson, but they do make really good stuff, and they're pretty on point. They're specialized. The fumes are specialized to capture and remove any harmful emission generated by 3D printings and other particles. A lot of denture labs have fume hoods, and they can. Some people do use kitchen hoods. I'm not particularly sold for that, to be honest with you. I don't know if they're as good as actually, like the laser units or any other, like the standalone units, for instance, from the Quattro, the up to 600 CFM. I don't know if they're up to a code, basically. I just don't know about that. And I tried to do some research on that. I couldn't find really that much. Do they work? They may work up to a certain point, but for uh a big production lab, you have like 4, 5, 6 3D printers going 24/7, even more than 3D printer, way more than like 10 printers. You may need something stronger than that, just because the kitchen hose is, I don't think they're that powerful, in my opinion. I might be wrong, and I'm hope someone in the audience can correct me with that, and I'm more than happy to hear about that actually. But all the fume hoods is what they do is they capture and vent outside all that toxic air quality. So it gets hooked up outside, get it out of the way, so you can keep breathing good air instead of whatever you whatever it's emission from the 3D printer. And I think Fran has a question now, I believe.
I do. So the first question is, are you using a fume hood while 3D printing or while using other fume causing agents in your laboratory, if you wouldn't mind answering? And I'm going to keep this up about 30 seconds, but I'm curious to see. It seems like, wow, we're up to 50-50 here,
Oh,
getting close to the 30 seconds, and I'll let you know. Um, so it's Paolo, it looks like 40% say yes, they are using a fume hood, while 60% are not at this time.
all right. So, um, a question that I would like you guys to answer at the end of the webinar is why you're not using it. I'm actually curious, and I'm not judging, you know, but I'm curious to know why you're not using a few modes or anything like that. Um, can you still see my presentation?
I can.
Okay, because it went it disappeared on my end for some reason. All right, so the next is fume hoods. No, oh, that's why. That's interesting.
Reset.
I'm sorry about that.
Sometimes that happens when I
Yeah, I noticed
do
that.
the poll,
That was interesting.
but we're good now.
Okay. All right, solution for um what to do, basically. Just, install fume hoods. They're they're awesome. They're really, really awesome. They can be nosy, very noisy sometimes actually. But, if you have a separate room just for printers, just keep it there. Don't worry about it. It'll be fine. But at least as soon as you get in there, you can um you can breathe without issues, without problems. Air purifiers, I know, as I said before, Quatro makes phenomenal products, and they're really well known in the industry for air purifiers, vacuum units, suction units, and fume hoods as well. They have all variety of stuff, and in all my labs that I worked with, we always had Quattro units, and including now that implant concierge. When I walked in at the office in San Antonio, and I remember smelling the first day that I walked there, I was like, I smell IPA. I was like, this is not going to happen. You guys need to fix this. And they ended up fixing it, but it was interesting the way I approached them at a time. Gloves, mask, as I said before, surgical mask, I would never recommend surgical mask. I would prefer to use a respiratory mask. They're not that expensive. You can reuse them over time and over time and over time without any problems, versus surgical mask, you have to get rid of them supposedly on a daily basis. I know not everyone does that, including dental offices. I know that for a fact. But that's what I recommend: respiratory mask. Safety goggles, that's a must. Safety goggles is 100% a must that you need to have, no matter what, no excuses. It doesn't cost you an arm and a leg. You have to wear all the time. For instance, let's say you're washing a few models on the IPA, and instead of laying down the models, you drop it because it drops. You lost it happens. The model drops on the IPA. That little IPA drops goes in your eye. It hurts like hell. It hurts like hell. I never experienced that, but I have met people that have experienced it, and it's not pleasant. So always safety goggles. And that goes even before 3D printing. Like I don't know if you guys ever cut metal sprues out of after you cast metal. And you use that big fat disc, you start cutting it, all of a sudden that it breaks and it flies out and it gets stuck in the ceiling. We all, if you work in a lab, we all have it. It happened before, it will happen again. If you didn't have that goggle, that eye protection, that disc could have hit your eye and you would have lost your eye, for instance. Lab coats, you can wear a gown, you can actually have a lab coat, but you should have something that you don't care that is long sleeve, not short sleeve. I know it's a pain because most of the times it can be really warm inside a 3D printer room, because it needs, most of these resins, they need to be quite warm in order to print. Like, for instance, all the nano hybrids, like Sculpture 2.0 and Rodent Titan, for instance, they need to be very warm because they're really dense. So, but I recommend doing a long sleeve lab coat or a sweatshirt that you don't care that it's a very long, that you can cover up until your knees. It would be ideal. Hopefully you're wearing pants and not shorts, and not open shoes. Always wear closed shoes as well, like sneakers or something similar. Like I said before, and I'm gonna repeat it until it gets stuck in your head, any uncured resin is not good for you. Or IPA. IPA on your skin, it tries you out like crazy. Post-processing 3D prints. It's going to be really briefly about this. Honestly, there's a couple things that I would like to touch up, because I see it all the time on Facebook. Why is this like this? What did I do wrong? I'm like, you guys even read this stuff? You have to read before moving forward. It blows my mind. But I'm one of those guys too. I've done it too. So I shouldn't be surprised, because I've done it. All right. So every resin is different and it has a different workflow. Like, I can probably tell you on top of my head that at least 3 resins right now that are completely different from each other. IPA 99% is recommended. 91 is also fine. I would not go below 90%. Harvest makes Innova Print. It's a different, it's a substitute of IPA. It's not, there's no alcohol. It is a lot more expensive than IPA though. I think IPA is like, you can probably buy a small bottle for $3 at the store or Amazon or wherever. I believe Innova Print is close to $30 for like a gallon maybe, or 1 liter. I don't remember the actual how much it is honestly, but I think it's around $30 for something. So the cost is much higher. There are others that substitute that are not alcohol, and there are alcohol free. I don't know if I wouldn't suggest those because a lot of people have been complaining that they leave an oil residue. So I wouldn't suggest going with that. Always use a PPE, gloves, respirator mask, surgical mask. Actually, no, no surgical mask, respiratory mask, and eye protection, eye goggles, and a lab coat or gown. Always wear it. Please use a validated workflow. Validated workflow are not for the little light gun cure like you use for chairside. That's not a validated workflow. Validated workflow is either auto flash or similar. Now, keep in mind when I say similar, I don't mean use a it depends on the resin first. And secondly, similar means like you can use, if you have let's say a frozen 4K for instance, or a mini 8Ks, whatever they're called, and you want to use a rodent titan to print, you can print, but then if you don't have an auto flash, you can use something else. As long as validated, it works, it will be fine. And the validated workflow for, I can speak for rodent titan for instance, or rodent sculpture, it's it depends on the glaze really, because they have an N2 free glaze where you don't need the nitrogen, which is, it's fascinating. It's phenomenal. So and in that case, you don't need the auto flash, and you can use a different kind of wash and cure, for instance, from Anycubic, and that's validated workflow for that resin. But that same the same workflow may not work for other resins. So always keep that in mind. I'm going to go over a little bit about nanoceramic hybrids, because I know there's a lot of people that are saying, oh yeah, it's, it's 70% ceramic filled. Yes, it's a phenomenal product. I love the product. Don't get me wrong. I'm a big advocate for a product for those products, and I print them all the time. But keep in mind, I do not consider them ceramic crowns because they are polymers. They're printed. They're not 100%. Granted, I don't even think zirconia and Emax are 100% ceramic, to be honest with you. There's probably something else that I don't know. And I might be wrong with that. So I'm not saying that I'm right. But you still have to be processed with IPA or similar, then it needs to be cured. It's not like your zirconia that mills, get sintered, and then again you can deliver it. Just like Emax. Emax doesn't get sintered, I get it, but similar situation. Emax can be pressed or it can be milled, and both of them, they don't have to go through IPA or any sort of like that. So always keep it in mind. Yes, I know they're 510K approved, FDA approved for permanent crowns. I get it. I just don't call them permanent crowns. First, nothing's permanent. Not even an implant is permanent because it can fail. So that's a different story that I'm not getting into the debate right now. We can discuss that in a different time. But always keep in mind that these are printed ceramic crowns. They're polymers at the end of the day. They're not 100% filled ceramic. And also keep in mind, Sculpture 2.0 is 60% filled with ceramic, right? Ceramic filled. They're super dense. I don't know if you guys ever printed with sculpture 2.0. It's very, very dense. Now, think how dense it is if it's 100% filled. It's gonna be, I can't even imagine. Since I'm talking about zirconia, I want to point out two pictures. All right. These are both taken from Google. I'm not gonna lie. Both of these pictures are near me. These are not my benches. These are not my hands. Not my zirconia or anything like that. But I want to point out this compared to this. On your right, you see glove. You see a suction unit. I'm sure this guy has a suction unit. I would hope. I would hope it has a suction unit. But you don't, there's no gloves. This guy is, you can see his fingers. That, I personally don't like it. First, because I don't like the feel of the zirconia dust on my fingers. That's one thing. Secondly, I've always been a believer that the oil on your fingers, because it always produces oil. It can contaminate the zirconia prosthesis that you're doing, and you don't see it until you start glazing it. And then you see, oh, this is not an A3, this is more like a, I don't know, A35, and I didn't apply anything, or it has some gray hue or whatever it's happening. So I've always had that issue. I've always had that concern that these oils can compromise the prosthetic of of the of my prosthesis. Am I right? I hope so. Because I didn't see any studies in the past 10, 12 years since I've been doing zirconia. I've always been a believer of that. So I always use gloves whenever it's possible, anytime, and mask, especially mask, and eye protection as well. Why mask? I can't say that I've always wear a mask when uh, depucking a crown or a hybrid on the zirconia puck. I can't say I've always done it that way. There's been times that I just, remove the crown and I will walk away. And while I was walking, one of my assistants told me, "Hey, you have some white stuff on your on your beard." And I'm looking at it, I was like, "Oh my god, it's zirconia." So keep in mind it's not good to breathe first, and secondly, you don't want to get pulled over and say, "Hey, no, it's actually zirconia dust." No one, I don't think we'll believe you. But when it comes to breathing, I believe the condition that it can cause is scoliosis, I believe it's called, and it's you really can't see it until you start getting the symptoms, and it is treatable, but I don't remember seeing any cure for that. So always wear a mask. I Between a mask and a respiratory mask, probably respiratory mask, I think it would be better for this particular situation. Um, or maybe even a surgical mask. I think that should be fine, but it needs to be nice and snug on your face. It can't be loose. Don't put your face mask and put it just around, just below your nose, because it doesn't make any sense at that point. Make sure that it's nice and snug on your face, on your cheek, and it's nice and tight, so it can cover the whole thing. So back to nanoceramic hybrids. One of the things that I see everything online, this was wrote in tight and printed, and you can see all these white chalk over here all around the prosthesis, right? You can see it everywhere. So why does it happen? Well, here's the trick. I wouldn't call it trick, but if you read the IFU that it comes with the bottle, every bottle comes with this instruction. You need to make sure to read them properly, because it tells you everything It literally tells you every single thing, hazard, health risk, how to process. So for protein titan, for these nanoceramic, I don't like to see that white chalk. If I'm doing a presentation and it doesn't go in the mouth, I don't really care. It will be some white chalk there. It's not the end of the world, but that's the difference because it's not going in the mouth. In my opinion, and I've only had one case that I know I had that white chalk all around because I overexposed. Excuse me, I overexposed to IPA, and I that thing broke within a week. Versus other hybrids that I've done in the past were completely fine. Like it was rock solid the whole time. But this particular case broke in a specific spot that it didn't make any sense. Like the connector was big, was nice and thick. There was no screw access hole. Everything was fine. It was passive, so it didn't make any sense with me. And the only thing that makes sense is that I overexpose to IPA, and therefore that white chalk, when I overexpose, I feel like it can compromise that chemical. So, um, what I do instead of washing it for 5 minutes, I dip it in the IPA and use for a quick 1, 2, 3 seconds, and then I use Q-tips on the screw access holes, or I use a toothbrush to go around, and that does the trick. Make sure to have our arrows on hand, and that will help you a lot. Clear all the access hole, clear off the resin, make sure that you're pointing it out towards where you're not, where it's a safe area. Okay. So as I said before, you can sandblast the chalky part. If you don't have a sandblaster microratch, like if you have work in a dental office, you don't have a sandblaster, you can use a microratch. I'm sure most offices have a microratcher at your office, so you can use that with microratch. I don't think they use glass beads. I think they use aluminum monoxide, if I remember correctly. If someone is in the audience and knows that you can use glass beads, please tell me. I would love to know. But I believe it's aluminum oxide. So you got to be careful with that because aluminum oxide can penetrate that prosthesis. Remember, this is not zirconia. I know it says zirconia filled, 60% zirconia filled into the resin, but it's not zirconia. Zirconia you can sandblast it, and I wouldn't go sandblast like crazy for 5 minutes, but if you really want to do it, go for it. Wouldn't recommend it. But it doesn't break. You're not gonna make a hole. This you're gonna make a hole. And that chalky part, the overexposed, like I said before, I think it does compromise the integrity of the prosthesis itself. And same thing goes for overcuring. Don't overcure, because it's not just it's not just the color. It's also the integrity of the prosthesis itself. It makes it weaker. It makes it more prominent to break. I see a quick question for you guys.
Yes. So are you using a vacuum or dust collector while milling or using a lathe in your lab? So it seems like so far, 100% of our listeners are using this. So great.
100%? Good.
100%. Yeah.
Good.
More and more
That's,
people are answering, so it's great. It's
that's
great.
good.
Everyone, 100%.
Yeah,
Fantastic.
I've been in dental offices where they mill zirconia and they don't use any suction unit, thinking, oh yeah, it's fine. I'm just gonna wear. It's just one single unit. It's like, I don't know, man. You should still wear it. You should still wear anything.
Oh,
Okay.
definitely. I mean, we have a mini lab in the dental office. I'm a hygienist in the dental office that
Mhm.
I work in, and they don't have any suction unit. They don't have
Yep.
any hoods going on. They're using the lathe. And it makes me crazy because of what I know. You know,
Yeah,
like,
exactly.
this
Exactly.
is not meant to scare anybody. This is just knowledge, guys. It's just knowledge. We ask
No, no,
Paolo,
no, no.
we're
This is meant to
passionate.
scare you guys.
Yeah, we're passionate about keeping all of you healthy. We need you
Yep.
guys to be able to deliver these beautiful restorations, 3D printing, milling, whatever you're doing. It's so important. It's important to the patients. We need you guys. We need you healthy. We need your knowledge, your expertise, your artistry. I
Hmm.
mean, we need you. And basically, this is just knowledge for you to decide what you want to do,
Yep.
how you want to move forward. And just knowing what's out there is important to us here at Zon. And when we brought this to Paolo, he was so passionate about this, right, Paolo? You're like, I've never seen anything like this. I want to be the one to deliver the message.
Yeah,
That's why we're
normally
doing this.
every time I speak for companies, I normally speak for about guided surgery, implant placements, and any anything related with prosthetic, how to sculpt tissue, for instance, all that kind of stuff. So when I thought about doing something like this, I got super excited, and Fran too. I was like, all right, let's do it. All right, I got a couple more slides to go over, and we're gonna then we can do a Q&A at the end, okay? All right. This is an example of this surgical guide material from Zerlox from Zon actually, and I actually printed a couple surgical guides with this, and it's pretty rock solid, and I do like it a lot actually. One thing that I I put a red line on is contains acrylated. I definitely gonna butcher. I already butchered that word, but I'm sorry about that. Monomers and oligomers. I'm terrible with these names. I'm so sorry. So just keep in mind that these are really sensitive. If any individual are sensitive to acrylic, it's going to have an allergic reaction, rash. So exactly what I said before. So always keep in mind, always read the IFU. It has everything you need to know about any about everything about your material. Okay. So you gotta be careful. You gotta be careful. Read the indication on the behind the bottle. It comes in the bottle and it comes there, so you have to read it. That's no questions. One thing that I would like I said before, with nano ceramic hybrids like rhodantidine, only wash it for like a couple seconds. Now let's read over here. Do not allow the parts to sit in isopropyl alcohol for longer than 5 minutes, as the properties may begin to deteriorate. So 5 minutes. The way I did it for this one, it was a 2 minute my first wash and 2 minutes for my final wash, and that's how I did it. I tested it. I used a hammer, worked fine. Not, I didn't actually chop it like with an actual hammer, but it gives you the idea how strong it is. Now, if I leave it for 5-10 minutes, then that it might be different. Like I've used my car and I ran over a couple dentures, resin that I printed out of, and without problems. And I tried one where I let that denture stay longer than 5 minutes, almost 15 minutes. I'm telling you right now, that denture broke in pieces. Keep in mind also that if you, for instance, have let's say you have supports, you leave it at the end of the day because you need to go, you don't want to deal with it that day because it's the end of the day, you really, really have to go yet on a doctor appointment after work. You come back the next day, those supports are probably crumbling. So if you're familiar with the resin, then good, that's fine. But if you're not familiar, you're just starting a 3D print, make sure to read this stuff because it's really important that you follow all this stuff, okay? So this is actually my favorite thing to do. It's fascinating in my opinion. I kind of like to see the results. So IPA, you can recycle. I know a lot of people, I know a lot of friends that recycle. I looked into it. And I remember seeing someone posting, commenting back. It's like, well, if you know what you're doing, you can make a little explosion. It's like, all right, I'm gonna stay out of it, and I never dig too much into it. But you can recycle IPA with some sort of instruments that you can buy online. Zon makes I believe, makes a phenomenal product called, I forgot the name now. Hold on, friend, if you don't mind chiming in from this.
For the IPA,
Yeah, for IPA and resin.
the Onulus is for the
Onulus, that's
resin.
right. Yeah, for
Yeah,
resin.
not
Yeah,
for
exactly.
IPA, it's for the resin.
Exactly. Yeah, yeah, sorry. Yeah, so it's a phenomenal, it's a phenomenal product, and it disposes for you basically. So it's nice to have it. Resin is a little different from IPA, obviously. IPA can evaporate, so you can leave it open, and you can leave it outside and keep it like that and don't have to worry about it. But make sure it's outside. Now, disposable liquid resin, don't drain it. Don't put it down on the drain. That's not good, because that goes everywhere. Uncured resin should be fully cured before disposal. You can sunlight cure. You can, like the IPA, you can leave it outside, let the sun do the job, and then you dispose it. But don't put it in the trash, because it's not good for the environment. Um, and once it's cured, like it says over here, it can dispose in the trash, but only after it's solidified. After it's fully cured, sunlight cured, dump it in the trash, then it's fine. But if it's not, don't do it. Make sure that it gets UV light, sunlight, whatever you want to do, that's fine. But um normally the sun will do a pretty good job, in my opinion. And I've done it, and I haven't had any issues with that. Um Now, the other thing that you need to dispose properly, and I know a lot of people don't do that, is glove and mask. All the glove and mask that you use handle resins, cleaning materials, like extra resin that got um dropped on the floor by accident. There's a little, you get your paper towel, you start scraping it off. That paper towel shouldn't be there, right? You can't just, it needs to be disposed by the waste regulation, basically. All right, conclusion: health risk with occupational fume and smoke, sore throat. It can cause, fumes can cause sore throat, runny nose, stuffy nose, irritated eyes, and a lot of stuff that is really not good for you. This is the one that I was saying before, silicosis, that normally happens if you don't have a good suction unit, and looks like you all do, so that's fantastic. Um, like I for instance, I do, believe it or not, I do have asthma, so I've always been cautious with in laboratories and dental office as well. So always keep in mind, always be cautious with any of this stuff, really. And I'm sure if I'm sure I can probably dig more stuff and be more terrified about 3D printing and whatnot. As much as I love 3D print, because nowadays I prefer to 3D print anything. If I could 3D print zirconia, I would do it in a heartbeat, and I'd give it a shot how it looks like, or 3D print Emacs or anything stuff like that. I know there's been talks about 3D printing Emacs. I'm not sure about the longevity of that. I don't know anything, honestly, about 3D printing Emacs or anything like that. These are my contact information. Feel free to shoot me an email, call me if you have questions, or if you need help with the surgical guide, I'm more than happy to help you out and go from there.
Thank you so much. I mean, again, there's hazards in every job. Paolo and I
Oh
discussed
yeah.
it earlier. I mean, every job there are hazards, and basically it's knowledge, right? Knowledge is power.
Mm-hmm.
We do what we have to do to protect ourselves every day, no matter what position we have, no matter what job we're in. I mean, like I said, there's hazards to everything. And,
Yep.
this is such a noble profession. You're all giving people their smiles. You're giving them, the means to be able to chew their food properly, to keep
Hmm.
themselves in a healthy state. I mean, without your profession, I mean, what would we do? Right. So basically, 3D printing is here to stay, milling is here to stay. It's how we do our job.
Yep.
And, it's basically, like I said, knowledge is power. So,
Yep.
we just want to give you guys the knowledge that you need to be able to stay safe and be able to, go home every night and be with your families and enjoy your life.
Hmm.
Like that's basically it. So we do have a couple of
Yes, I
questions.
see them.
I
Yes.
just want to say hi to Letitia. I've been speaking with her basically, all week, and I'm so happy that she's here. She said she wanted the information on how to join. So Letitia is so happy that you're here and you're joining us, and she wants to know: is it required by OSHA to have a fume hood, above printers?
That is a fantastic question, and I do not know the answer. Is it required? I don't know. I gotta be honest with you. I don't even think OSHA has anything about 3D printers, honestly. I I might be wrong with that.
Yeah,
I might be
I'm
completely
not
wrong.
sure
I'm
either.
not sure. I will research that, and if you don't mind, send me an email and I'll let you know as soon as I can.
Perfect. And now Mary, Almerico. Hi, Mary. So many great people on this webinar today. So happy that you joined us. Mary wants to know Cure Box, CURE in capitals box. Is that okay?
Yeah, so I'm actually the cure box. I assume you're talking about the from Asiga. That's the only cure box that I know, at least. Is it okay as a workflow for validated workflow? Yes and no. There is some validated workflow for some resin, most of the resin actually, but there's some resin that you still need a better solution. Like the cure box, as much as I liked it, it was very slow for me. Like I remember, I think the Keystone night guard, the key splint soft, it would take, was it 20 minutes per side or 15 minutes per side or something crazy like that. I was like, I don't have that time. So um yeah, so definitely um it's definitely a good validated workflow, the cure box. But there are some resins out there that I would prefer other uh box, like auto flash prints. Auto flash is the gold standard for 3D printing.
So Letitia wants to know if the Ceramil Motion 2 already has a suction unit, or is that a separate edition? I am not sure on that, but you probably would know.
Yeah, I have no idea.
We'll have to definitely find that out from
Yeah,
AD and get back to you, Letitia, on that.
yeah, I'm not sure. I gotta be honest with you.
So Sandra wants to know why not using a dust collection and vacuum. I don't know if that question is for me in my office, but I have no idea. I don't know why they're not. I mean, they're crazy. That's why. And the docs that I work with, they know they're crazy, so I could say that online. Is there a way to forward this webinar to my doctors? Letitia wants to know that. And yes, you're definitely going to get, and this is for everybody, the recorded webinar in your email. So our Zon marketing team is fantastic, and they make sure that everybody, whether you just have to register. So whether you watch or you don't get to watch, you're always going to
Mhm.
get the recorded. So you can go back and watch it again. Check your spam. Sometimes they make it in there. I don't know why. But you will definitely get the recorded webinar. You always do with us.
Yeah.
Um, Ernie. Ernie is always on as well. So thank you, Ernie, for joining us again. And it's in our best interest to have the fume hoods as opposed to having OSHA order you to do it. So that's, I think that's more of a statement for him, and we appreciate that,
Yeah.
Ernie, definitely. I know you've been at this for a long time and you do the right thing. So that's great. Gio wants to say, he says, "Hi, I just started to work digitally and don't know much about it, but this information was very helpful." So
Well, thank
Gio,
you.
thank you so much. So we do have, I do have, if you want to, send in some more questions, please do. There's just a couple of polls and they're for us. So, if you're interested in adding a fume hood, a vacuum, or a dust collector to your lab equipment, just let me know. And what I will do is, as soon as I get your information, it'll be me calling you and we can discuss exactly what you want, what you need. Um, I'll be able to work with our equipment team to get you a price or a quote. Just write yes or no, and I'd be more than happy to give you guys a call sometime tomorrow. I would think I would get your information and we can just discuss what it is that you're looking for and how we can help you here at Zon to keep you guys healthy and just,
Hmm.
whatever you need. We're here. We're here to help you out. So I'm going to end this poll. And then there's one more. We have our new Zerlux print resins. In the model, in surgical guides, in the gingival mask. If you're interested in trying those out, they're fantastic. I can get you a price on those, definitely save you money, but will not, hinder on what
Hmm.
the quality of the material is. And I know, Paolo, you tried a couple,
Yes, I
but
did.
I can give you guys a call and let you know what the price point is on that, but also, answer any questions that you have on any of these print resins. But again, we are just committed to giving you everything you need to be successful and also to keep you as healthy as we possibly can so you can keep on giving our patients these beautiful. Oh, we have some more questions, Paolo. Wait 1 second. Okay, so
I
Richard,
have resin in my Asiga tray when not printing. Do I leave the hood on permanently? Yes, absolutely. Keep it on. Because what happens is any sort of light that comes inside the tray, it will start curing your resin. So always keep that hood down all the time. Lights off and keep it down. Don't leave it up. And also keep in mind that resin smell is going to start evaporating as well. So you don't want to do that.
yeah, definitely. And Letitia is saying that this was an amazing webinar and thank you
Thank
so
you.
much. We love that. We love it. Try to give you, the best information that we possibly can. I want to
Hmm.
let you know what's happening next on Zon Academy. So first, all you moms out there, I want to wish you a happy Mother's Day. That's coming up next week. So happy Mother's Day, all the moms. And on May 14th, we have making business decisions when you know it's the right time to commit to growth. And we have Mike Farrago. He has an MBA and he's also the owner of Concord Dental Lab in Massachusetts. And he's just great. And he just opens up, business practice and opens up his whole lab to us. We've had him on a couple of times at Zon Academy, and he's one that everybody keeps saying, please bring him back. So he's going to be coming back to us May 14th, 2 p.m. Eastern. So make sure you get on and definitely register for that one. The next on May 21st, we have the future of 3D printing, Asiga's latest and greatest of 2025. So Bryce Hiller is going to be joining us, and he's going to be giving us what they have coming up in 2025, what's new with the Asiga, and we love having them. Our Philadelphia Roadshow is happening, so if you're in the area and you want to join us, that's June 5th and 6th. June 5th, we're going to be having our design course, hands-on course. There's only 4 seats left for that, and that will be on ExoCAD, all on X Design. And the next day is our Philadelphia Roadshow. We have everything 3D printing, milling. It's like a little mini trade show. We're going to be focusing on nesting. We're going to be focusing on photogrammetry with Shining 3D. We have an awful lot for that roadshow, and that's going to be in Philadelphia at a beautiful Marriott there. So if you want to join us for some hands-on courses and some demonstrations and a great day, go to zondental.com, go to the education tab, and you can sign up right there on Eventbrite. We look forward to having you join us. And I believe that's the end of the questions. Again, if you have any other questions and you want to email them to us, please don't hesitate. We'll get them over to Paolo. He's great about answering. after the webinar. And thank you so much, Paolo, for your insight,
Yes, thank you.
for your research. We appreciate you, and I appreciate all the listeners. Thanks for joining us here and trusting us with your education. I hope you
Awesome.
guys have a great day. And
Thank you. You
see
too.
you again on Zon Academy. Thanks again, Paolo.
Thank you. Thank you, guys.